Welcome back and thanks for staying with us. Well, African heads of state met in Addis Ababa this week, where among their guests they had the UN's Secretary General Antonio Guterres, as well as billionaire Bill Gates, who want to help the continent deal with some of its problems. Now, the Health Minister, Dr. Aaron Motsoaledi, had some interesting comments to make on the back of that meeting, and he joins us now to talk about that, but also the latest developments around NHI. Good evening, Minister. Thanks very much for coming through. Something interesting that you're quoted as saying this week, that as it is now, it is difficult to arrange a simple meeting between health ministers on the continent, which suggests that whatever Bill Gates and Antonio Guterres may have come with, to partner with the continent on resolving our health issues, that opportunity may be lost if people, you and your counterparts across the continent, don't get their act together.
No, that's not what I was saying. You see, the heads of states came with something very progressive, which excited us. That for too long they've been regarding health just as one of the social expenditures. They've now realized actually it's an investment in economic growth, that no country on the continent or anywhere in the world anywhere can ever grow their economy if their health system does not pick up. That health and the economy, are inextricably bound. Now, that was the line which excited everybody, but at the end of these heads of states inputs, together with Secretary General of United Nations, Director General of the World Health Organization, a former minister, the former Minister of Finance in Nigeria was made to summarize. And she said, I'm feeling very guilty. I realized when we're in finance, we ministers of finance on the continent did not regard our counterparts in health, very highly. And we just used to dismiss them. And this is wrong. And that if they don't meet, I'm worried that what the heads of states are saying will never actually materialize. So when he finished, we gathered together as ministers of health. We know each other and those who have retired. And they were saying, but this is true. Heads of states have moved. And if our ministers of treasury doesn't move along with them and understand these issues and still regard health as a social expenditure, which is problematic, we won't go anywhere. So it was about that, and we even agreed that somebody high in the United Nations must convene ministries of ministers of treasury around the globe, and even with our presence, and discuss that. Look, guys, from now onwards, if you want your economies to grow, you must know that health must be an integral part of that. We even gave an example about Davos. Davos has, this World Economic Forum where we were in January has been there for 40 years. But the first time that they ever considered ministers of health as important people who must attend Davos was in 2015. And I went there for the first time in 2015 to attend Davos. And there was a reason. It didn't just occur. All this time they were saying, no, when you grow economy, you want Minister of Finance, public enterprise, minerals, economic, etc. Now, why did they call us? It's because they realized what happened in West Africa, where health has been neglected for a long time. It took 9 months of Ebola. Let me put it this way. The economy of Sierra Leone was growing at 14%, which is huge, but I accept that it was from a lower base, but it was it's a very high growth. If it happens in South Africa, it will be heaven. But it took 9 months of Ebola to put it not in zero growth, but into negative growth. And experts say it might take 2 decades for it to kick back where it was before. Now, that realization say it means a health problem anywhere in the world can actually bring down economies of the world. And that's why health has to be regarded in a different light altogether. So our problem was, but we realized that on the continent, it looks like in finance departments, that type of thinking has not yet taken root.
But a lot of Africans may not share your view that African heads of state have actually moved. Because if you look at the state of neglect, and the fact that many of them can simply leave their countries, and they go to India, as we saw with the Zimbabwe vice president the other week, and that's where they get their health care. So they don't prioritize health. So, why should we?
No, I know exactly what you mean. That's why I'm laughing, because that last statement, I've said it in many fora. The last time I said it was in Victoria Falls, where the ministers of health in Africa gathered together for the African chapter of the World Health Organization. It's an annual meeting. And I said there, we will be happy that the healthcare systems of Africa are functioning. On the day on which heads of states get their treatment here, they shouldn't be going outside to other countries. I said that, and I remember the media chased me, especially the BBC. President Mugabe, former President Mugabe, had just addressed us, and he left. And they thought I was referring to him. I said, no, but I'm not referring to Mugabe. I'm referring to the general situation. Do you know how many heads of state died here? Died in Europe, have to be brought home. And I agree with you 100%. I was not allowed to speak in that forum because it was a heads of state. And I said, if I were allowed, it was one of the things I was going to tell heads of states. When I said they've moved, they've at least moved mentally. What is left is for them to move in deeds. Mentally, is for the first time that they said such a statement. That health and economic growth are inextricably bound, and investing in health is investing in the economy of your country. So that is a thinking. It's quite a shift. But you are right, what is left is the action. And I too, and I'm repeating, I will say health system on the African continent have improved satisfactorily. When heads of states get their health here, they don't have to go to Europe, to the Far East, or to America. And that, I still stand by it.
Which brings us to NHI. You gave an update this week about the NH bill, which is going to be coming before Parliament soon.
Well, I'm sure you are aware that this was mentioned by the head of state during the State of the Nation address, and even yesterday when you were closing, that we're going along with this issue because all over the world, we believe is the new way of running health system. Even in Africa, in the African Union, the reason that I said there's a mind shift of heads of state is because they endorsed it. In Davos, almost every meeting I've attended, every event I've attended, this was a central issue, universal health coverage. We even took a decision in Davos. A task team has been selected to drive a process towards taking it to heads of states in New York in September this year. That means it's going to be what is called a high-level meeting, where not ministers of health, but heads of state stand up and debate that this is what I'm going to do in my country. In AU, they even said we are going to get an instrument that must trace country by country what the progress is. So it's a very important program which the world want to undertake.
Well, sectors or sections of the private sector are still digging in their heels. Where do you see the biggest obstacles as this legislation is being piloted through Parliament?
Well, they are digging their heels, and to be honest with you, I'm anticipating a constitutional court case. I do know some people who are already preparing for that. They've already started sending questions, which I call them snipers, already to prepare. And it's not something that is new. If I give you a clip, which I have, of the debate that ensued in the UK, 70 years ago when they introduced this system, national health system, you really believe it's South Africa of today. Because the same arguments that are being forwarded were forwarded in Britain. But Minister Aaron Motsoaledi went on against all odds. And in 10 years' time, mortalities, especially child and maternal mortality, had dropped by a whooping 80%. That was the achievement, but everybody said this is going to collapse the system, this is going to what? And now there's a new, what you call here in South Africa, there's a a new approach that you need to be rich to implement that system, that, the British are rich, European countries are rich. And that's worrying, because in essence, if we think like that, it means European countries are moving towards socialism in health. African countries are moving towards privatization in health, which is a very, very confusing concoction, because it's supposed to be the other way around. So when Britain introduced this system, it was 3 years after the Second World War. The British, government was almost on the verge of bankruptcy. Their health system was non-existent. But they realized that's the time they need to pick people up, because they were devastated by the World War. But they said this is the time when our people need a healthcare system that will finance everybody, not just the few who are elite.
But in spite of all the challenges and obstacles that people will throw at you, including, as you suggest, court challenges, you're going to trudge on.
Well, I think the moment the bill is passed by Parliament, when it passes it, there are going to be constitutional court cases. I really believe so, from the way I'm seeing, from the behavior of people. Some of them is out of mere misunderstanding, and they make assumptions that are wrong. For instance, I've just seen an assumption that we are going to lose 132,000 jobs because we are not going to contract the private sector. And I said, how can people lie like this? You know why I'm saying so? We've just finalized signing, contracting of private sector people to come and help us clear the backlog on oncology and on mental health. The people who have been sent, you just sign it.
But then are you surprised if we aren't able to pay doctors, for example?
Sorry?
I'm saying, are you surprised that people have those suspicions when, in certain instances, we can't pay doctors, like it happened recently?
That's precisely why you need NHI. Why are we unable to pay doctors? Because South Africa is already spending 8.7% of its GDP on health. And the World Organization recommends only 5%, so which means we are far advanced. But the problem is, out of that 8.7%, 4.5% goes to 16% of the population. And 4.2 goes to 84% of the population. That is the one that is struggling to pay doctors, meaning money is there within the system, but it's spent only 16% of the population. And that's what NHI needs to change, so that if you are unable to pay a doctor because there's no full-time doctor in public, you can use the private sector, which is what South Africa is not doing. So actually you need NHI to solve those problems. Now people are saying solve them first before you bring NHI, which is, they are bringing a chicken and egg situation, that before you have a chicken, lay the eggs first. Another one will say, but before you have the egg, you need the chicken. And I said, please don't take us there. We want a system that will provide for all South Africans. We have seen it working in Britain. We have already got a template. And for 70 years, they knew that there's nothing better than it.
Minister, we've run out of time, but I have to ask you this, just for a few seconds. Your erstwhile comrade, Motsoaledi, what do you think should happen there now?
About what?
About the president being a collaborator or imbimbi.
No, but you are aware that when I responded in Parliament, I raised this issue because I was completely shocked and confused. 36 years ago, we called Motsoaledi to Alan Taylor, residents of University of Natal, to ask him about this, because the rumor then, remember, black consciousness was at its height at that time, and there was a debate. The rumor then was that during the pre-Frelimo rally, lots and lots of activists were rounded up by police. A few were sent to the Robben Island, others were released. And there was this rumor about those who were released. And we said, they said, no, there were problems even in the office of SASO. So we said, we want the truth when those who went to jail come out. And one of the people we brought there was Motsoaledi. And if we asked him that question in the public student body meeting he addressed because it was June the 16th, I would have understood why he pulled back. But it was in a room. We called very few senior.
And what was his answer?
Sorry?
And what was his answer?
No, he said there was nothing like that. He said it's not true. These rumors are spread by the system to divide us and cause confusion. There's nobody who sold us. Now, when he
now
said
the same Motsoaledi now.
I said, hey, how do these stories know? Was there a reason that he could lie at that time? No, they shouldn't. Is there a reason that he's lying now? Most probably. because of the politics in which we are now, you know.
That's where you're going to leave it, Minister. Thanks very much for coming through. Dr. Aaron Motsoaledi.